So, this evening, I am very, very excited and very grateful to Miss Natasha Berridge for taking the time to chat with me. So, Natasha is a consultant oral maxillary facial surgeon. She is just absolutely brilliant. I honestly feel so privileged that she's scheduled to talk to me. I'll just see if I can get her online now. I think the connection is working. Hello. Hi, how are you?
Kathleen, how are you?
Oh, sorry, let me just change the sound setting here. Can you hear me?
I can hear you delightfully. How are you?
I'm doing really well.
Thank you for having me.
Oh, thank you for joining me and taking time out of your schedule. It is so nice to have you here.
That's okay, it's a pleasure. What's the reception like, by the way? 'Cause it's a bit sketchy at times. So can you
Um,
see and
I can actually see and hear you really, really well. So hopefully it will stay like that for the entirety of our conversation.
fingers crossed?
Lost. Um, so I was hoping that you could introduce yourself to anyone who doesn't know who you are, and sort of explain what it is that you do.
Okay, so my name's Dr. Natasha, Natasha Berridge, known by so many names, and I am a consultant NHS oral and maxillofacial surgeon who also has an interest in aesthetics. So I work in an aesthetics clinic in addition to my NHS work. There we go. I'm duly qualified in medical dentistry, and it's taken me a long time, a hugely long time. So, whew.
Yeah. No, it is such a long training pathway, and that was kind of where I wanted to start. I was actually having a chat this evening with my fiance, and I was explaining, like, to be what you are, you can't just have a medical degree or a dental degree. You have to do both.
Yeah.
So, which of those did you do first?
So I'm a dentist first by training. Studied at King's College London, and actually, when I was at King's, I knew that I was probably going to be a facial surgeon. I'd always had an interest in surgery, and just realised that was my calling. The only downside to that was that I had to study medicine, so go back and do medicine as a second degree. And I just remember my folks and everybody around me just saying, "Are you absolutely sure this is what you want to do? Because it's going to take a huge part of your life training to be a facial surgeon." But I was completely tunnel visioned actually, and I don't think, in fact, I know that back then there weren't the career opportunities that the younger generation have today. It was a very focused pathway for me, which was dentistry. I then went back and I did a SHO in the facial surgery to make sure I could do it. And I fell in love. I was completely convinced it was the right thing for me to do, and got my place at medical school actually when I was still at dental school. Went back and studied a 4-year medical degree program. So during that, I was able to work as a dentist to fund myself through medical school, which wasn't cheap. And that was it. That was the start of the journey, and taken over 20 years. I mean, gosh, when I think about it and I look back, as time goes by so quickly. It really does. So I definitely think there were moments where I thought, is this the right thing for me? Most of my friends are becoming settled and they're getting on with their career. You can get quite frustrated because of the length of time that it takes, but actually, it's been worth it. It's been worth it because I have fulfilled a childhood dream of mine, actually, which is to be a surgeon and more so become a facial surgeon. So that's my journey so far.
Amazing. And so you were working as a dentist and you were a full-time medical student at the same time.
Yeah.
I mean, I imagine that wasn't easy. How did you balance those two things?
I think it was difficult, but I didn't have other people that relied on me at the time. So actually, when I look back on my time, it was probably, yeah, at the time. I had a fiance, had a boyfriend who I then married after my medical degree, but I didn't have kids. And so I only really had to worry about myself. So doing crazy nights, working as a Max Facts SHO, actually, every other Saturday was pretty much what I did until I decided. Sorry, my little boy's just walked into the room. But he loved me. Are you okay? Okay, yeah. Was pretty much what I did until I went back and I actually got into competitive higher maxillofacial surgical training. So I think it got harder as I had the kids, because I then had to balance motherhood with surgical training. And I found that a challenge, definitely. So that was probably the more challenging aspect of my career. It gets harder, but more fulfilling as time goes by. So I hope that answers your question.
Yeah. So that was actually one of the things I wanted to talk to you about, because I think it's quite a I don't know if stereotypical is the right word, but it's a question that you get asked a lot if you're interested in surgery as a female. I used to find this question very tedious, where people would say, "Oh, but how are you going to have a family?" And then as I progressed through my career and my training, I've sort of appreciated what was behind that question a bit more. Not in that I don't think it's possible, because it very much is possible, but I have had mentors in surgery who were brilliant, but who have actually stepped away from surgery because they found that balance so difficult. And, you know, that was what was right for them personally. But for you, how do you have any advice for people that are maybe struggling with that balance, or how did you find it, you know, going through such a rigorous, difficult, long training pathway, as well as having a family on the side?
So I won't lie, definitely challenging. I have to say as well, Emily, and it is challenging at times, because I don't think I've had to think about this, and I've asked people the very same question, which is, how do you achieve a work-life balance? And it's really difficult to have 50-50. I think the way that I try and do it is that when I'm at work, I'm focused on work. And then when I come away from the operating theatre, when I'm away from the hospital, I try and focus on kids 100% of the time. But my kids, particularly my eldest son, he's 9, and I had him at the start of higher surgical training. He's so aware that I've been absent because of my career. He's very understanding. God bless him. He is, you know, he's a lovely kid, and he understands, and he's proud of his mom, definitely. But if you said to him, "Would you like to do medicine?" his answer would be no, because surgeons have to spend time away from their mummy, their kids. So I'm acutely aware of that, but at the same time, I do think that you have to have something for yourself. You have to be able to give your best version of yourself to those that support you, you know, your loved ones, your friends. So without a doubt, a really good network, a supportive network, is so important. I can tell you that I wouldn't have been able to do it without my husband, who has been fantastic with the kids. Without close friends, you know, when I've had low days, have cheered me on, you know, that they're my biggest champions, actually. And that's what you need. You just need to have a group of people that are going to be for you, not against you, because, as you know, the NHS is a wonderful machine. And I suppose it's just human nature in general, but there are always going to be people that doubt, that are naysayers. And I say, you just have to get rid of the noise. So the balancing act between family life and being a surgeon, I'm still learning. I don't think I'll ever have it sorted 100%. However, I'm much better now at compartmentalizing. So work is work. My kids, that's it. You know, that's my family time, and I think that's helped. I definitely think that's helped as time goes by.
And as you've progressed through your training, have you ever had to deal with colleagues or consultants who weren't very understanding or supportive? You know, if you're thinking about, oh, I'm going to have to go on maternity leave soon, or how is this going to affect the training? Did you have to sort of come up against that and deal with that?
Yeah, I think we'll be real, and I'll try and be as authentic as possible. And so I've been pregnant twice throughout training. I've got 2 young boys. One I had at the start of training, and the other child I had just when I was sitting my exit exam, the FRCS. And the majority of people, so I suppose, you know, there was a fantastic dean who was very much women in surgery, you know, pro women at time out to have maternity leave. But let's face it, there are some archetypes, uh, male surgeons who I suppose need to move with the times, really. And, you know, the fact is there are more and more women coming into surgery, and there are more and more women in surgery that don't have to be. There is this archetype of female that needs to be a surgeon, which is that you can't be feminine. You don't have children. Decided to fulfill being a mother for your career. I just don't believe in any of that. I just think it's definitely possible to have it all. It is difficult to have it all at the same time, but it's possible to be a mum. It's possible to be a feminine surgeon. It's possible to do all of those things, and it's possible to have a fulfilling career. Why can't you? But as I said, I think it goes back to before. Support is paramount. That support network is key to everything.
Yeah. And you know, I can't tell you how much I love hearing you say that, because I actually have been told so many times that I don't have the personality for surgery, which
This,
I hate
um,
hearing, because I'm, you know, I'm nice and I'm
yeah,
soft spoken and I'm not aggressive, I suppose. And I'm like, well, you don't have to be those things to be a surgeon. And you know, maybe if you're dealing with difficult, you know, people or people that are pushing back against you, you do have to be a bit assertive. But you know, I always hated being told, oh, you're not a surgeon, you seem like a GP to me, or a geriatrician or something. There's nothing wrong with being those things, but I was like, my, you know, what is it about me that makes you say I can't be a surgeon? That I'm nice? Like, that's ridiculous.
I would say that, you know, I think I've been told by a woman actually that I don't think you've got the what it takes or the personality to be a surgeon. And this was a female surgeon. This was back when I was doing my core surgical training. So for those of you who don't know, after you complete your foundation training as a registration house officer, doctor, you then choose to either go and study medicine or do a surgical training program, and that's what I chose. But it was at that stage that, yeah, and to be honest with you, Emily, I have had to develop a really thick skin. That is what I would say to people that are considering doing a career in surgery. That is almost, without a doubt, one of the most important things as well. You know, that resilience, that determination, that focus, and that ability to be able to wash out the noise. Because there will be naysayers, there is negativity, and you just have to ride the wave. Um, and that's hard at times,
Yeah.
but you can't allow somebody else your story. You can't allow somebody else to predict your destiny. So you've got to be true to yourself. And I would say surgery, go for it. It's wonderful to see so many young women that have an interest in wanting to do surgery. It really is. And I wholeheartedly encourage you go.
And did you ever have moments where you were reconsidering surgery, or did you always sort of know kind of deep down, you know what, this is what I want. I'm not going to let anything or anyone sort of push me away from this path?
At 2 o'clock in the morning when you're waiting to take your case to theatre. Oh, what am I doing? What am I doing? Gosh. Or when you're sitting inside and you're studying for the 100th exam and your beautiful baby boy is outside with his dad, or they've gone off in central London and they're having a glorious time, photos. Or when you have to turn your mates down, you have to turn friends down, you can't go to special events because yet again you're on call. So there are many moments where it's like, oh, but I have to say that it's almost like that scenario of risk versus benefit. So it's a little bit like, you know, look at all of the positives. There are some negatives, but for me, I think the positives far outweigh the negatives of a career. So
That's brilliant to hear. And if we can just go through, so what exactly was the entire pathway that you had to go through to finally become a consultant, just so that people have an idea of the training involved?
Sure. Well, with regards to my interest in aesthetics, that's something that I'd always been interested in, actually, but there was never any formal doing non-aesthetics when I was at dental school. I mean, I was at dental school I started in the 1990s, late 1990s, and then I went to medical school in 2001. We're talking quite a time ago. So aesthetic medicine has really become quite a new career. Had it have been around when I was choosing surgery, I still would have made the same decision, actually, and that was to go down the surgical pathway. So I did dentistry for 6 years because I intercalated in a pharmacology. I then worked as an SHO in oral and maxillofacial surgery for 1 year, so that's 7 years. I then went back to medical school and I did a medical degree for 4 years. So you're looking at 11 years of just basic training. And then when I graduated from med school, they had just introduced the foundation training, so the F1 and the F2 program. So I did my F1, I did my F2, and then just like anybody else, I had to then competitively apply for a full surgical training program. And to do that, I had to have my MRCS Part A, and I also had my MFDS, which is dentist equivalent. So I'd fully completed that by the time I got into core surgical training. I then did core surgical training for 2 years, and I did that with Imperial NHS Trust. So I worked at the Hammersmith Hospital in Charing Cross. You have to cover a scope of surgical specialities: neurosurgery, ICU, endocrine surgery, that was fabulous, and a bit of general surgery. And then it's at that stage, actually, I got my MRCS, and I had to competitively, so that's a national recruitment program, to go into maxillofacial surgery at ST3 level. So applied for that, and got that actually in my first choice location, which was London. It meant I didn't have to leave after training. And the career pathway from that point is you complete your training from ST3 to ST7 in 5 years. If you want to do a fellowship, you have the option to do a fellowship either pre-CCT, so that's before you complete your exit exam, that gets you onto the specialist list of oral and maxillofacial surgery, or you can do a fellowship after you've got. So I did that, but my higher surgical training as a registrar in maxillofacial surgery was somewhat extended because, as I mentioned before, I had 2 children. So one right training and a year off on maternity leave to be with him. I had a difficult pregnancy, unfortunately. And then my second child, I was studying or sitting the first part of my exit exam. And so my pregnancy with him was very turbulent, and he was very excitable, and well, very early actually. Had a very premature baby. I had a number of issues, so I had to get out of training. I think I took about 14 months out. So you can see that prolongs your training, actually. They prolongs your training. I went back to surgical training part-time. So just talking about types and attitudes, there are a lot of people that thought this is fantastic. I think as a surgical trainee with a young child still in the exam, it was definitely the right thing for me to do at the time. Some people, some surgeons with a very old attitude that were like, well, what are you doing? You can't do surgery part-time. I mean, you know, you and I will think that's ludicrous, right? But that was it. You know, I was facing attitude at times, but I did it. And actually, it didn't stop me in any way, to hinder me, because, you know, I passed my exam on both the first part and the second part, and I applied to do a fellowship in reconstructive surgery. So, you know, that was a brilliant thing for me because it allowed me to marry my love of aesthetics with surgery, and that was a wonderful thing to do. Really enjoyed that. and that was a nationally competitive thing to do as well. So it's open to surgical trainees from plastic surgery, ENT, and maxillofacial surgery. And yet again, I got my with that, which was fabulous. I also wanted to, I suppose, ratify my experience in aesthetics, and that is non-surgical aesthetics, so Botox. And there was a fantastic course that was introduced, I think, halfway through surgical training, and that is the distance learning course with the University of Manchester in aesthetic aging, aesthetic medicine, and skin aging. So I got onto that course, and it's a 3-year full-time course, and I did that in addition to being a surgical trainee and having 2 young children. And I have to admit, I thought it'd be a breeze, a walk in the park, because of my huge interest. I thought this would be brilliant. It was a lot of hard work, actually. I found that quite onerous because there were lots of assessments, quite a lot of exams, and that I had to complete in addition to filling my assessments, to being a surgical trainee, which is having another book, making sure assessments are on track, also getting through your ARCPs on an annual basis. So yeah, that was it. But I finished all of that 2009, which was when it was such a relief. It was one of those moments where you feel a little bit emotional because from a training perspective, you finally got there. And I got, I see, and I became a specialist on the register of oral and maxillofacial surgery. So that was wonderful. But then the real hard work starts.
No, I never had.
Story. So yeah, got onto the register, which was amazing. And then you have to start, you have a different hat on because you've got to start thinking about consultant jobs. And there is so much to consultant jobs. So, what do you want to in? Where do you want to be? Do you want to work in a teaching hospital? Do you want to work in a district general hospital? Just so much. You have to consider that and take into account that support network that we spoke about. So a lot to consider. And here I am. For me, also really, really important to continue doing my aesthetic medicine, my treatment. And so I work with a wonderful bunch of colleagues at Dr. Medi Spa, and I'm able to combine that with my NHS role as a consultant to beautifully marry each other. In addition to having joined a private collaboration with oral and maxillofacial surgeons with the group, and that's been brilliant, actually. So looking forward to seeing where that takes me.
That's brilliant. So at the moment, how is your time split between the NHS and the private aesthetics? Is it about 50-50, or do you spend?
No, unfortunately, well, NHS practice takes up the majority of my time, and any small amount of time that I have, I then spend that doing aesthetic treatments. And moving forwards, I will, the maxillofacial surgery work as well. So my NHS job is my biggest commitment.
And when it comes to the types of surgeries that you perform, because I feel like not everyone might know the types of procedures that you do, what is like your bread and butter? What are the core operations that you'll be performing day in and day out?
Okay, I've gone really dark. I turn the light on.
Oh, yeah, go ahead.
A moment.
The sun is setting now.
Okay, sorry, I don't know if that's any better. Probably not, but
a little bit better.
So routine oral and maxillofacial surgery, I divide that between elective work and emergency work. So the emergency work are all of your acute abscesses that come in, facial abscesses, complications of facial aesthetic treatments, infections, acute occlusions that might come in, dental abscesses. Facial trauma is a huge, but I suppose that depends on the unit you work in. So mandibular fractures, orsal fractures, zygoma fractures, soft tissue lacerations, and that might be caused from, interpersonal violence. It might be caused through stab wounds, gunshot wounds, forcing incidents. And so that's the beautiful thing about having a number of different units actually around the country, is that the mechanism of trauma differs dependent upon where you go, which is fascinating. A little bit of dental trauma, and then you might also get your elective patients come acutely. They've had a problem post-acutely. So that's the emergency side of things. From an elective point of view, so I personally specialise in cancer, or the management of skin cancer, which yet again marries up beautifully with having done in skin aging. It really does. And the reconstructive aspect of that I really enjoy. So, seeing younger patients with skin cancers, and although the majority of skin cancers that I treat are non-melanoma, so we're talking about squamous cell cancers, basal cell cancers, they're the commonest types, and also the correction of post-traumatic soft tissue deformities. The reconstructive side of that is hugely satisfying and can go very nicely with the aesthetic, and my training in the aesthetic surgical side of things is great actually for the corrective aspect of pathological disease. I also specialise in facial deformities, that is skeletal discrepancies that will lead to facial disharmony, so to speak, and a dental malocclusion. So someone that might come in with a really big chin, someone that might come in with a massive gap between their upper and their lower teeth, facial asymmetries, and treating that combined approach of orthognathic surgery and orthodontic treatment. The other routine bread and butter that you get in a surgical unit is the management of oral mucosal disease. So dry mouth, white patches, amount of white patches, ulcers that don't go away, so suspicious lesions that might need to be biopsied. There's a lot of temporomandibular dysfunction syndrome that comes through. So I know that in the world of aesthetics, that's become quite hot, giving Botox to slim the lower face. But actually, from a medical treatment perspective, we've been using Botox for myofascial pain from temporomandibular joint dysfunction for many years. And the consequence of that is treating mesenteric treating myofascial can lead to jawline slimming. We also get ivory gland issues that might come through, and also just complex dentoalveolar pathology. Wisdom teeth, which is something that most people would know a maxillofacial surgeon for. That's a very common routine procedure. There are other specialist areas, so neck cancers, and the reconstructive management of that is huge. It's not something that is my subspeciality interest, but I've certainly been trained in it. There's also cleft and craniofacial stuff. So Emmeline, it's huge actually. That's what I think is so wonderful about maxillofacial surgery, is that there is a vast array of things to choose from. So if you have an interest in soft tissue, it's there. Interest in hard work, it really is quite unique as a surgical speciality.
And so much variety, as you were saying, so many different things that you can do. And again, I mean, it kind of goes without saying, but anything that affects the face, has a huge impact on a patient's quality of life. So really incredible field of surgery. And you mentioned, I was just interested, so you mentioned one of the emergency things you might do is deal with aesthetic complications. So would that be things like vascular occlusions?
So the aesthetic complications quite a lot of. They're often later, to be honest. So we will get acute facial infections, that be an abscess formation or cellulitis. And certainly, when I've worked in London, we get a number of patients that would come in on an acute take that have got a spreading facial cellulitis, and it's secondary to filler. It's secondary to filler that might have been 2 years ago. It's secondary to filler that might have been put in a lot more recently. I think with the vascular occlusions, they have probably, I think now with increased awareness amongst aesthetic practitioners, either being dealt with by them, or when they get to the emergency department, potentially dealt with by them. But there are a few occasions where the facial surgical team has been called. So yeah, it is actually hugely rewarding. I suppose one of the big things about being a maxillofacial surgeon as well is the crossover with ENT and the acute airway. So spreading infection is, well, we all know, it's a killer in the form of vagina. So that's also, I think, important to mention as well.
So do you have the opportunity then to do quite a few joint cases with like ENT colleagues and other surgical specialties?
I think that's, I think collaborative working is, and since becoming a consultant, I've made a point of doing cases with my ENT colleagues. We also have ocular, the hospital that I work at. And it's just wonderful. It's you learn a bit from them, they can learn a bit from you. Best for the patient as well, And I really do enjoy that. I enjoy the meeting of minds. That is wonderful. But the specialities we would work most closely with, certainly in my unit, are and oculoplastics at times. And the dermatologists, actually, I don't know why I've forgotten that. I mean, they're the feeding pool for the skin cancer cases that we see. So I've spent a lot of time working with dermatologists, and that's been a wonderful thing as well.
And then I think we just had a question come in. It was just asking, what's the difference in job description between oral surgeons and maxillofacial surgeons?
So oral and maxillofacial are dually qualified and dentistry, so it's following that career pathway of doing either medicine first or dentistry, and then going on core surgical, which you can only do if you're medically qualified, and then doing oral and maxillofacial surgery training, which you can only do if you are already qualified. An oral surgeon is someone that is highly skilled in doing complex dental alveolar cases. They take teeth beautifully, but they haven't been to medical school, and they're not medical doctors. So they are dental surgeons, they have done dentistry, and they do a training pathway which is recognised GDC. So that's inherently the difference. An oral and maxillofacial surgeon is a general medical council, a GMC recognised surgical speciality. An oral surgeon is a general dental council, dentally recognised speciality, and as a consequence of that, your training is as a dentist. And it's the same thing. It's just as it's gruesome in the sense that you have to do your exams, work-based assessments, and you CCT, and you then become a specialist on the oral surgery. So, but that is recognised by the GDC and not the GMC.
Okay. No, I think that's a good question, because I feel like a lot of people, especially in the general public, they might not know what the exact distinction is between the two.
Yeah, I agree. I think there's a lot of confusion between what an oral maxillofacial is and what an oral surgeon is. And essentially, an oral maxillofacial surgeon is accredited and on the GMC specialist list is a doctor and a dentist. An oral surgeon is a dentist.
And one of the other things I wanted to ask you about was obviously the COVID pandemic and what that has been like, as a surgeon working through the pandemic, how it's affected surgical practice. I think a lot of people are aware, that for surgery in general, a lot of elective procedures were postponed or put aside. I think a lot of operating theaters were actually turned into temporary ICU wards as well, just to help kind of deal with the huge surge in patients we had. But what was it like working during the pandemic for you?
I think, Emily, and I couldn't agree more. I think you've hit the nail on the head. It has had an unprecedented effect, hasn't it, on the delivery of healthcare services. And with, in particular, for my own speciality, in my own, I can only speak from personal experience, but all of those things happen. So, you know, theatres, ITU, which meant the capacity to do your elective cases, your day surgical cases, very much reduced at the height of the pandemic. That meant also that certain cases were, they had to be ratified. So only emergency procedures were going ahead, and the cancer cases were going ahead. So oral mucosa cancer, mouth cancers, and skin cancers, which is what I do. And emergency operating wasn't affected at all, as you can imagine. And also it had in the outpatient clinic. So we had to become, I suppose, we had to think of better ways of being able to still see patients, but minimize the risk of COVID transmission. So telephone clinics have surged actually in the pandemic. So that's how I would say it's affected my surgical practice. But hopefully now, with the mass rollout of the vaccine and lockdown measures, there'll be very long waiting lists, but hopefully we can see a return to, I don't know, some sort of normality is the hope.
Hopefully. And did you get, your juniors pulled away from your team to help cover other specialties or wards? Because I do know with some of my colleagues in surgical training, that was a big issue for them is, of course they understood and were happy to go help out, but it was pulling them away from their actual surgical training. They weren't able to do what they had hoped to do with the past couple of years, basically.
I think definitely, I do feel trainees, because I think one thing's for sure, it has affected training. And it's just been really hard. It's affected, everyone. Services have been affected, and as a consequence of that, training has been affected. There is a surgical book, there are a certain number of procedures that you have to do, but it's a nationwide issue, and how that will be dealt with best is open for debate. So bless the current surgical trainees. They just have to keep the faith that it will be okay. Will be okay.
Yeah, hopefully. I think we're all very hopeful, for brighter things ahead. As you said, with the vaccine rollout, and with this latest wave kind of being under control.
Yeah.
I just wanted to circle back to aesthetics, actually.
Mm-hmm.
So you mentioned, obviously it fits in really beautifully with your surgical practice. Again, was it something that from the beginning of your training you had an interest in, or was there something specific that brought it to you, or that, made you aware of it as a medical, a field of medicine that you could engage in?
I think that interest in it all, for me, it all began with the management of soft tissues. And that's probably one of the taught as a core surgical trainee is, suturing and suturing well. And it's remarkable, isn't it? Because that's what the patient sees. They see soft tissue, incision, the healing of that. They don't see maybe the bony one underneath, or how long potentially the procedure has taken. They see the end result, with soft tissue scar. And that, I suppose, was when it all started for me. I loved suturing, loved it. So as an SHO in oral maxillofacial surgery, loved doing the suturing, loved doing the facial laceration, great joy and great fun, actually. And there was a female oral maxillofacial surgeon who was in my region, and she had an interest in this. I just remember thinking, gosh, I'm really inspired by what she does. Totally, totally, totally she does. And marrying those two things together, then going through training, and we had an introduction to Botox right at the start of my training program, actually, taught facial surgery that had a aesthetic facial surgery practice, and it really just started from then. So I would say right at the start, before I probably got into my facial surgery as an SHO, as a core surgical trainee, the interest was definitely there.
And in terms of, doing that alongside your NHS work and your surgical training, again, was it something that you kind of had always done alongside the core NHS work, or was it not until you did your master's in aesthetic medicine that you started, practicing more?
So I would say that as a surgical trainee, I just wanted to focus on what I needed to do, and that was being a surgical trainee. So I didn't practice aesthetics at that time, although I was really fortunate because I was able to do fillers within the NHS. So treatment of facial deformity, facial nerve paralysis, contractures of pedicle flaps for head and neck cancer patients, fillers in patients that have got craniofacial deformities, cleft lip and palate patients. I remember I worked at UCH, I had a clinic actually where aesthetics clinic for NHS patients, so patients that had facial deformities, so patients that, didn't like their skull, didn't like the stigmata of surgery. And so it was wonderful, and that's how I used it. I would treat patients that came to clinic with mesenteric hypertrophy from having really heavy clenching habits, or those that were just excruciating pain from temporomandibular joint dysfunction. So that's how I cultivated my interest in Botox and fillers whilst being a surgeon. And then obviously when I did my TIG, reconstructive aesthetic surgery, and I'd CCT'd and got my FRC, so got my, I was then able to do it more from a cosmetic perspective and feel comfortable about doing that because I'd achieved what I knew I had to as a surgical trainee.
Amazing. And do you have a particular procedure in aesthetic medicine that is a favorite for you to perform?
Yes, I tell you what I love, and maybe this is because I am trained in orthodontics, but I love lower profiling. So creating a lovely line, doing a good chin. To be honest with you, I love it well, and I love a little bit of Botox. It is wonderful. Lip enhancement, just all of it really.
And one of the things I was curious about, I just wanted to ask you, is there any stigma with your colleagues about doing aesthetic medicine on the side? Because I have sometimes found, when I'm speaking to consultants, if they ask me, oh, is there anything else that you're up to? I don't necessarily want to mention medical aesthetics because sometimes there is a little bit of, again, like, it's considered maybe a more superficial pursuit. But have you encountered that, or what are your thoughts about that?
Oh yeah, and I remember when I discussed with one of my consultant colleagues, I was a trainee, surgical trainee, that I wanted to do an MSc in aesthetic medicine. And the response was, oh, you want to be a Botox queen? And as you can see, Emmeline, it didn't stop me.
No.
Fine, that's your
being a Botox queen.
Yeah, Botox. That's your opinion. Actually, no, I'd love to do something that is going to enhance my surgical practice. And without doubt, I feel it enhances my surgical. So that's what I have to say about that for sure.
Love that answer. The other thing I wanted to ask you about was medical writing, because I think it's something that you're quite involved in. So you're on the editorial board of the PMFA journal, and is medical writing and sort of being involved in that side of things, is that something that you've always sort of done throughout your career? And how did you get into that position of being on the editorial board?
So I, as a core surgical trainee, as a higher surgical trainee, publishing papers is a huge thing. You've got this quota of papers that you have to publish, scientific papers. And if you get the opportunity to publish them in a ratified surgical journal with a high impact factor. But I think there is a bit of a divide between those that are researchers and can churn out paper after paper. That's not me. And those that are clinicians and write in a different way. And I think I realised that I wrote in a different way. And I much more enjoyed doing the papers that were based upon how do you do it, or a new novel surgical technique. So really enjoyed that. And I do love conducting interviews. I love, writing about surgical skill and experience, but it is in a different way to your classical paper, which you have to praise. So the opportunity came up to join the editorial board, and I thought, this is fantastic. I'd written for the PMFA journal before, and one of the guys who I hold in very high esteem is one of the older generation maxillofacial surgeons. I've been on that board as well, and so it just seemed like the natural thing to do with my interest in reconstructive aesthetic surgery, aesthetic medicine, and skin cancer management. So that's been brilliant. It's a really good thing to do. So anyone out there that has ideas for papers, please send them to DM me.
Perfect. And do you also work with is it a site called is it Salon Privé?
Yeah.
Yeah.
Salon Privé is one of my passions, loves, that I do outside of all my other commitments. And that's just being a freelance medical columnist. And as I said to you before, I like talking to people. I love listening to other people's journeys, their experience. And it's just been a great way of connecting with people that I probably wouldn't have connected with, and sharing, health and beauty, and being able to in a way that's easily digestible, actually, because as you know, writing for a scientific journal is quite different to writing for a journal that has a global readership that's not directed towards medics or dentists, but to the non-medical people. So,
and I think I do think it is a skill. I think and I find myself doing this all the time, but you get so used to your own jargon and your own way of talking about things or explaining things with colleagues, and sometimes I'll be chatting with a friend or my fiance who's not a medic, and he'll just be like, what are you talking about, what you're saying? And yeah, and it is something that it's a skill, I think, actually, to write about topics like in medicine and science that are accessible to everyone. You do kind of forget that not everyone knows these terms or this jargon, but it's something I love doing too.
Yeah, and I think you should continue to do that. The thing of pursuing a career in surgery is having a balance and having a release from what you normally do. And for me personally, I believe that makes a well-rounded surgeon. So when I get my come up, they talk to me about their other interests. I don't know if you would consider me a new age consultant, but definitely encourage it. Definitely. We all have different talents. There are many different types of surgeons out there. I think it's really important to be well-rounded and balanced, actually. So keep up with it.
And what are some of your other sort of interests and passions and love outside of surgery?
Well, aside from my spending time with them and just spending time with my husband, family time, I absolutely used to love doing hot yoga. That became a real passion of mine before. I was absolutely devastated when COVID hit. Just like I haven't been able to do the way of gym classes or going to yoga. What I did do was buy a bike.
Oh, okay.
Love it. So love bike riding. That's become a real passion of mine, and walking. So we've walked in many places and rediscovered London, which has been beautiful. So lots of hidden Thames Walk pathways over there, lots of beautiful parks, and outside of London as well. I work in Shropshire, and that's a beautiful county. So it's been wonderful to be able to explore that, particularly with my kids actually. So that's been great.
Well, I do think that is one of the things that's come out of the pandemic, is that has been one of the only outlets a lot of us have had, is walking and exploring. But then it's led to a lot of sort of discovery, of the places around us where we live that, we didn't even sort of think about, or we weren't even aware of before this.
Absolutely.
Oh, sorry. And I was going to say, I can just totally relate to the yoga thing, because I love my yoga. It's been such an outlet for me, all
Yeah.
through medical school and as a junior doctor, and not being able to go to yoga classes has been killing me.
It's hard, right?
Yeah. Because I'm not good at exercise. So it's the one form of exercise that I've been, able to keep up with and willing to do. And then I
Yeah.
haven't been able to do it.
Oh, I know. Well, I do. Is opening up again. Safe
Yeah.
is, I don't know, but yeah, I think I'll be rejoining. But in the meantime, completely satisfied with walking and the bike riding, which is
And is there anything in particular that you're really, really looking forward to when things open up again?
a holiday,
Yeah.
a beach.
Where do you want to go?
Oh, Emmeline, anywhere that has got a beach. Have to admit, we absolutely love Europe. Portugal is one of my favorite destinations. So only recently discovered in the last sort of 3 to 4 years. And prior to that, I probably would have gone a lot further afield. So love the Caribbean, love the Americas, but actually Europe has everything. So I want to do it all. Italy, Spain, Portugal. Yeah, city trips, really do.
No, there's so much to see and explore there, and then it's all on our doorstep as well. We don't have to go far to, spend a long weekend there. So I'm with you. I'm really looking forward to being able to travel again.
Fantastic, fantastic.
So thank you so much for taking time out of your evening to chat with me. Um, just before we end, I was just wondering, do you have any advice for young aspiring female surgeons who might be having a bit of a wobble about whether or not they want to continue with surgery or even go into surgery? Is there anything you would say to them?
I think just being honest with yourself, I think you have to ask yourself what it is that you want. And only you can do that. Um, you can only do that in the quiet of your own mind. It's tough. It's not for the faint-hearted. So that's the first thing that I would say. There will be many challenges along the way, but it's also highly rewarding. Um, and if you want to do it, go for it, and go for it with passion, gusto, focus, resilience. Those would be my words. Don't forget your support network. Don't lose outside interests. And try and try and try. We spoke about this earlier. Try and maintain that work-life balance, which isn't always possible. But when you're at work, you're at work. When you're with friends, family, you're absolutely dedicated to them.
Amazing advice. I love that. Thank you so much.
Mental, because that helps. It helps seeing someone that's got there, because I suppose it keeps it real and it keeps it in perspective. So having a mentor as well.
Yeah, I completely agree with that. I think it makes a huge difference. Having someone to speak to who's been through it all, who knows exactly where you're coming from, and who can help guide you.
Yeah, no, I think so too. So definitely the right thing to do.
Okay. Are you going to do anything fun with the rest of your evening now?
I plan to watch a little bit of Netflix. going to do. So I'm going to relax, unwind, watch a bit of Netflix, put the kids to bed actually. They're not in bed, and just relax for the evening. So how are you going yourself?
And are you at work again tomorrow?
I'm not. I'm not until the end of the week, so I've got a few days. Great.
Oh, good. Well, enjoy your next few days off.
I
Thank
will.
you for giving up your evening to chat with me. I just thought it was a brilliant conversation. It's so great to just hear your experiences and your insight. Having gone through, what I would say is one of the toughest surgical training pathways imaginable. So again, I really appreciate you taking the time to talk to me.
Emily, well, look, thank you so much for having me, and have a really good evening. It was my pleasure.
Thank you. I'll talk to you later.
Take care. Bye bye.
Bye.